Good morning. It's Thursday, July 8th, and you are with us with The Doctor is In. Ask Dr. Arwady. I'm Sybil Madison, Chief of Staff to Mayor Lori Lightfoot.
And we're very honored that she's taking time. We started a little late because there were things going on, but we've enjoyed doing this so much over the last year plus.
Happy to now be a special guest occasionally on Dr. Arwady's show. And as you all know, this is Dr. Allison Arwady, Commissioner for the Chicago Department of Public Health. This is where you can still and always get the facts about COVID, about the vaccine, here in Chicago. And you can ask us questions. You can put them in the chat box below, or you can send them through Facebook or Twitter using the hashtag AskDrArwady.
That's right.
So we're going to check our distance.
Yep, we're still distanced.
We're still distanced, fully vaxxed and still distanced. And let's just get into the data, huh?
All right, sounds good. So as always, we will start with our local data here in Chicago, chi.gov/COVID-. We've had millions of visits to it, and I hope you are among them. So if we pull it up, we see the news really continues to look good. And as Sybil knows, you know, this is data that we look at every day and we share with the mayor almost every day. We're keeping a lot of close attention on all of these metrics. We're averaging 37 cases a day, exactly flat from where we were a week ago. We're averaging just over 4 hospitalizations, new hospitalizations every day. That's down from last week. Between 0 and 1 deaths per day, also down from last week, which is really good. I know, isn't that great? We're doing about 4,100 vaccinations every day, which, you know, more than 4,000 vaccines is good. It's certainly nowhere near where we used to be, but you can see that that dropping has plateaued a little bit, and we certainly are doing all of this door-to-door and outreach and at home and, you know, continuing to vaccinate thousands of folks every day. We're doing about 6,200 tests every day, and you see that is down. That's down about a third from a week ago. Some of that is because it's a 7-day average, and we always see it drop over the 4th of July. But not surprisingly, when cases are in pretty good control, people are less likely to have symptoms. We expect that to drop off. And in that setting, our positivity is at 0.8%. That is up a little bit from last week, but I'm not concerned about it. It's mostly being driven by the drop in testing and you know, a positivity under 2% is very good for us. I do want to just quickly...
It's actually unbelievable.
It is, when you think about where we were, right? It really is. And, you know, there are a few counties down in southern Illinois that are starting to see some surges, do have some positivities back up in the 2, 3, 4, getting to 5% range, seeing real increases in cases, but it is very heavily landing in unvaccinated people, just like we've seen all along. I wanted to very quickly, we'd gotten a question from Jen Jarmula wondering about how to get daily cases, not just the average, so I wanted to show that to you real quickly. If you go to cases here, this actually does show you what's happening daily. So I put this from mid-May to July, and you can hover over any day. So for example, on the 5th of July, there were 39 cases. On the 4th of July, there were 12 cases. Not, you know, 4th of July, not going to be a big day unless people are really not feeling well, probably, to get tested. So all of the data is still here. It's just that first page is the average. And then also, we've gotten some questions in just about where are we in terms of vaccine coverage. On the summary page, right at the beginning, that's our top level. Just over half, 50.2% of Chicagoans, including all ages, are fully vaccinated, and 56% of all ages have gotten at least 1 dose. But then if you come over to here to vaccines, you can look at it in more detail. So among those who are eligible here in Chicago, people who are 12 and up, 65% have gotten a vaccine, 67%, a little over. If we're looking at adults, 18 plus, 72% of 65 plus have gotten the first dose. And you can go here, you can look by age. So about 43%, for example, of our 12 to 17-year-olds have now gotten a dose. That's been going up really quite nicely. You can look by gender, you can look by race, ethnicity, you can look by zip code. So that's how you can use this dashboard to answer more about the questions that you have. I also wanted to show, actually, we've gotten some questions about, a lot of questions about the Delta variant.
Yes.
And I thought I would actually show you some data from the UK. So this is, you know, all over the world, obviously there are dashboards and people tracking it. This is data.gov.uk is where you can find this. And this is in The Guardian, one of their big papers. But if you look at this graph here, In the UK, new coronavirus cases per day. See how this is just shooting up dramatically? So you can see they've been fairly similar to us in terms of having, early peaks, this really bad December, January, and then now are very much having a very big peak again. However, what I want to highlight and what's different from what we had seen previously is that where we look at UK hospitalizations, this is that same time frame, we are seeing very few hospitalizations, right? That increase has been much, much lower. And similarly, where we look at deaths over the whole pandemic, that increase in deaths has been almost nothing. And that is because of the vaccine. And all of this is in the setting of now almost universal Delta. So let me show you this. So COVID-19 variants in England over time, this red here is the Delta variant. And you can see, they had almost none in March. And then it started, and then because it is more contagious, very quickly overtook what had been the Alpha variant. Is this light gray was what most of what they were seeing, and then now 99% of the cases are Delta. And this is the CDC shared just this week that as a country, Delta is now the predominant variant, the strain of COVID that you are most likely to get. Here in Chicago, it's still not the dominant, but it will be. Like I said, we were expecting that to be sort of this summer. And we are on track for that. It's somewhere in the 1/3-ish range in our region, but it's growing. And some of that is because we've had other variants. But so in the setting of a lot of Delta, in fact, almost universal Delta, big increases in cases, and that is obviously concerning, but not turning into the major hospitalizations and deaths. And it's just important, right? Like, we are in a different world with the vaccine, because as long as the vaccine has, the vaccine has continued to be very protective against cases too. So don't think that this is all, vaccinated people who still got COVID. It's not. But that even
that was going to be my question. Putting those things together.
Yeah, no, but you do see, it is a very contagious virus, and also there were a lot of people who had only had one dose in the UK. That was actually an approach that they took, and one dose turned out to not be very protective. So anyway, if folks
does that also suggest, I might have cut you off, that the care, what we know about caring for people who have COVID is making a difference in terms of the few deaths that we're seeing?
I think that's some of it. We've gotten very good at caring for people. I think also when you don't have an overwhelmed healthcare system, you don't have this problem of running out of doctors and beds and spaces and ventilation. And so the ability to really make sure the people who are the best at treating COVID are the ones treating patients with COVID. When your numbers are low, people can absolutely get a lot of attentive care in that setting. So I think that's part of it. But I just, this is why it's not just about cases. It's about what are we seeing with cases and hospitalizations and deaths. And the news really on variants and vaccines continues to be good. Thank goodness, it really does. And if you're interested, you can look here. It's comparing a little bit of the coronavirus waves. So the third wave, what they're having right now, you see these cases are just going up much faster than they did in the second, but then how much lower hospitalizations here in that third wave, and how much lower,
dramatically different.
For deaths as well. So, this is some of the kinds of things that our team is looking at around the world as we're trying to follow and predict and make decisions here. I also wanted to just very quickly, before we get to questions, show a couple of quick slides and just give you a few updates about some operations. So first of all, as I think people know, a lot of our city-sponsored big vaccination sites are closing as we're moving to more of the hyper-local work. And so for first doses, we officially closed on July 3rd, the Chicago State University, Kennedy King, Richard J. Daley, and Wilbur Wright College. Now, at some of these, they're technically closing Saturday, July 24th, because we're doing second doses. And if somebody comes, we'll give you the first dose, but they're going to have to get a second dose somewhere else. And really, by July 24th, we're going to be out of those. Malcolm X College remains open. And then importantly, the CDPH Greater Lawn Immunization Clinic, which we talked about on Friday, that is going to be a permanent site, for vaccines. It's down on 55th Street. And there will be some, other opportunities, but it's about fitting COVID vaccine into our regular work, right? This is an immunization clinic, and that's a lot of what's happening. And so as we make those transitions, I did want to remind people there are plenty of appointments available. ZocDoc.com/vaccine. You can make an appointment for that same day all over the city. You can see all these dots showing where there's availability. You can also walk into pharmacies. You can make an appointment with many, many doctors' offices, or you can call our number, 312-746-4835. We will answer any of your questions, or we will set you up for Protect Chicago at home. And remember, anybody over the age of 12, we will get you an appointment, up to 10 folks at your house, completely free of charge. We will bring it to you, and there's that Grubhub gift card that comes with that. And we're really encouraging people, if you're going to take advantage of that, everybody does not have to live at the house to do this. So you are welcome to bring in your extended family, your neighbors, up to 10 people. We love vaccinating multiple people if we're going on site and doing this. So for those of you who are having conversations with friends or thinking about this, one opportunity is like, let's go ahead and get you scheduled. Let's get together and get vaccinated, or even, have the friend vaccinated, have the Grubhub celebration together. Really, and we've seen very good uptake with this, by the way. Hundreds and hundreds of people all over the city signing up. We are probably going to expand capacity in this program, but there are still appointments available. So it will probably be a little later in July if you call today. But we are getting people booked, and we've been really pleased with the uptake that we've seen here.
It can't get more convenient.
Can't get more convenient than that, exactly. I also, yesterday, you may have seen in the news, Chicago Public Schools started really talking more vocally about some of the work that we're doing together and that they're doing to really promote vaccine. It's not that long until school's starting, right. And so especially for kids who are 12 and up, you want to ideally start that vaccination at least 5 weeks before school starts, so that your child can be fully vaccinated before school comes in. But so starting next week, there's some new summer vaccination opportunities. There's 5 district schools, and then the back to school bashes, where we always are thinking about kids catching up on vaccines, et cetera, trying to make it easier for parents to get the things their kids need. So you can go to cps.edu/vaccinations. There's going to be additional work that we're doing, but this was sort of the first wave of starting to talk about that, and it'll be a major focus for us in the fall, excuse me. Also today is the first drawing for Illinois' lottery. So all in for the win. If you have been vaccinated, you are already entered, and the first.
Oh, really?
Yes, really.
I didn't know that.
Yes. And the first drawing is today, and there will continue to be drawings. I think it's weekly. There are a few $1 million prizes. There are more $100,000 prizes, and then for the kids under 18, there are $150,000 scholarships.
Yeah.
And
that's awesome.
And so we'll be excited to see that. And if you're not vaccinated yet, you can get vaccinated, and you won't be in the one for today, but you'll be in the one sort of moving forward. The last, or just 2 more quick things, is that our Chosen Few DJ music series, as part of Protect Chicago Music Series, we've had these concerts, right, that are available, sort of a thank you to Chicago, get vaccinated. It's how we can do fun things and gather safely. And so there is a free Chosen Few event on Saturday, August 28th. It'll be in the afternoon, 12 to 7 p.m. down at Chicago State University. These are all the DJs. I hear this is very exciting.
This is awesome.
Yes. And you've got to be fully vaccinated by the 14th of August to be able to come to this concert for free. So you should go to chicago.gov/PCMS, Protect Chicago Music Series. That's chicago.gov/PCMS. You can either sign up for a ticket if you are already vaccinated, or you can, sign up to get your vaccine and be able to get a ticket that way. So we're excited about this. There's good capacity, and do you want to just tell us a little about what this event is normally?
Oh, well, the Chosen Few. Everybody, a lot of people know about these DJs who play house music. And if you were around Chicago back in the day, these were the guys that you listened to on a Friday or Saturday night on the radio. So this is just super exciting that we could be with the Chosen Few, which they bring people together every year down in Jackson Park, and that people could be together in person at a concert with the Chosen Few. So I think they did a live stream concert over the holiday weekend. But this would be the opportunity to be there in person with this super famous around the world group of house head DJs.
Great. So thank you. And then just the last thing is just to give you a sense. Every single day there are new pop-ups, community-based vaccination sites. This happens to be one going on right now at the McDonald's down at 6560 South Stony Island. If people are coming in to McDonald's for lunch between 11 and 3, they are being offered free vaccination as well as a free crispy sandwich meal and a free vendor pass. And so, just again, chicago.gov/vax calendar is where you can see all of these. There's, 40 plus this week alone kind of around the city. And, it's been really nice to see a lot of spaces really step up and say, let's do this and let's bring folks in. So just to give you a flavor of some of what's going on. Some sweeteners, exactly. And so with that, I think we can turn and get into some of the questions. But I took that a little longer because it was related to a lot of the questions that were coming in about what's happening.
Yeah. Well, here's a good one from Alicia Squires, Facebook. I was vaccinated via Walgreens in March. How do I get my name in? I think that's into the lottery.
Yes. So if you were vaccinated, it doesn't matter if it was at a Walgreens, at your doctor's, at the hospital, at a CDPH site, in Peoria. If you were vaccinated, you're in. So you don't need to do anything. They are using the very secure public health registry, basically, of vaccine. And so they have advised people to watch your phone, watch your email, and they will be reaching out. And there's a week after the winner is chosen to be able to claim it, and they will be sharing publicly the location, like the county of where the person is, and it will actually be up to the person if they want to identify themselves. But it's exciting, and again, the point of the lottery, sometimes, we get sometimes these questions, why are we bribing people? It's that we have seen in some other states and in some other places, this really drive conversation and interest in vaccine. It's not the reason I would choose to get vaccinated, but let me tell you, my own staff are kind of excited about the possibility that, maybe they, like we were all joking this morning about if one of us, wins the $1 million, what we're going to do for the department, and that, before they retire is what they were saying. Yeah. I think it does drive conversation and interest. And I have talked to people individually who have said, my husband didn't want to get vaccinated until I told him this was a better chance in some ways, than some other things, and did make that decision. So, different people are motivated by different things. And I am excited about, about that.
Yep. And every vaccinated Chicagoan counts.
Every vaccinated Chicagoan counts. That's right.
All right. Here's a question from Paula. What are your thoughts on where COVID came from? Was it a lab or an animal?
Okay. Good. So good question. I think the most likely source for COVID is zoonotic. That's the fancy name for coming from an animal, zoonotic. And the reason that I think that's most likely is because that is how we have seen other epidemics, especially coronavirus epidemics, start. So if you look, the most recent, SARS, severe acute respiratory syndrome, that was from actually a bat originally, and then it was actually a bat in southern China, like in this same region where there are a lot of different coronaviruses. And then it went through a civet, which is a cat, and then ended up infecting humans. Also MERS, Middle East Respiratory Syndrome, similarly related to animals, Ebola, related to animals. Like, this is a path that we know of and that we worry about. It's why we track bird flus closely. It's why we really think about this. And there has been in China, for example, there's a lot of research into this, of course, and we don't have the final answer. I want to be clear about that. But for example, they've identified there's a particular species of bat in southern China that the genome, like the fingerprint, is about a 96% match for the virus that causes COVID-19. That's very close. It's not 100%, right? And so there's still some work. Are they going to able to identify exactly, which animal, was there an intermediate, et cetera? You would know kind of for sure if you were able to identify an absolute match, but there's not been any hallmarks of like genetic manipulation, like the way that this has evolved doesn't look dissimilar from how you might expect a virus to evolve, and we've continued to see this evolve. So the reason why I think there's been attention on this lab is that, first of all, Wuhan happens to be the site of a very well-known lab that studies viruses. And in fact, that same lab was part of uncovering how SARS started. So there has been some concern that, nobody really believes that this was in any way sort of like a bioterrorism or a intentional anything. There has been a theory that, could there have been someone who was working in that lab on, bat COVID viruses, maybe got infected, didn't know it, left, et cetera. I think that's less likely. It's not completely ruled out, and that's where there have been calls for China to be more transparent about, was there anyone who was sick at that lab? What is that? And I think there hasn't been the full intelligence there, and so that's why there continue to be some focus on that, and it's not totally ruled out. But I think my feeling is, unfortunately, this virus has shown its ability to continue to mutate perfectly well, without us, in terms of the variants that have come later. And based on what I know about how viruses evolve, I do think the most likely thing is that this probably did start from animals, just as we've seen in others. But that's kind of where that little question sort of still is. Regardless, the way we treat it, the way we work to prevent it in the future is not different. Yeah.
Okay. Here's a question from Scott, sent in by email. I have a friend with a vitamin D deficiency who is interested in getting vaccinated. I've learned that having a vitamin D deficiency can result in a more severe COVID-19 risk or illness, but I can't find anything on the effects, risks that vaccine may have on those currently dealing with a vitamin D deficiency.
Okay.
So here's a vaccine ambassador trying to talk.
I love it, exactly. And thank you, Scott. I really love hearing, I have a friend and this is their question and I've been looking into it. So vitamin D deficiency is very common, particularly here in Chicago, because we're in sort of a northern latitude. And, something like 2 out of every 5 people in the U.S. have some level of vitamin deficiency. There is some interaction with vitamin D and the immune system, and this is what the reference is, that there have been some theories that people may have more severe COVID if they're vitamin D deficient. I always, I'm a primary care doctor too. I regularly check my patients for vitamin D deficiency. A lot of them are deficient, and so I, have them take vitamin D supplements, eat more of the foods that have vitamin D in them. There is no reason that someone with a vitamin D deficiency should not get a COVID vaccine. There is not an interaction there, and there's no reason that the vaccine, we would not expect it to work or that it would have a negative side effect. And if anything, as Scott rightly notes, given that we know, anything that might not be as great for the immune system could lead to more severe impacts of COVID. I am especially, for people who are concerned about their immune system, getting that COVID vaccine is important. So good question. I hope that helps you talk to your friend about it.
Okay. Also from Scott.
Okay.
A different friend.
Okay.
Has epilepsy and saw.
Good job, Scott.
Yes. And saw a horrific video on YouTube about negative effects that the vaccines had with those on those with seizure disorders.
Yeah.
I have some good info from the Epilepsy Foundation for her, but any reassurance from you, Dr. Arwady, could seal the deal.
All right, Scott, you're doing beautifully there. I love, actually, that you went to the Epilepsy Foundation, because this is exactly what we want folks doing. Going to, reputable scientific sources that are looking at the data with a particular focus. There is no reason that someone who has epilepsy should not get vaccinated. There's not been a connection between the nervous system and the way the vaccine works. I'd say the only thing, there is a small risk that people will sometimes have a fever after they get the COVID vaccine. Sometimes in young children who get very high fevers, occasionally can have a seizure. That's different than epilepsy. That is not the epilepsy disease. That is not linked. And so that I could imagine where people are hearing this and saying, oh, this could be linked. That maybe that some of that is coming from. But I know without even looking at it that the Epilepsy Foundation would be recommending the COVID vaccine for people who have epilepsy. And then obviously, as always, I would encourage you to tell your friends to also talk to their doctors where they have specific questions. But broadly speaking, for both of those, the vaccine would be recommended, especially because people with underlying conditions are at potentially more risk for having more significant trouble if they do get COVID.
All right. Here's a question from Bob Fisher from Facebook. Has anybody asked about the Lambda variant in Peru?
Okay. Yeah, good question. So the Lambda variant, let's take a step back again about variants. So I want to be very careful here that we don't get into the sort of variant of the week hysteria, or not hysteria. This is not a hysterical question, but the Lambda variant is a variant that was originally detected in Peru, I believe late last year, and it has recently been labeled what's called a variant of interest. So remember, there are thousands, hundreds, thousands of variants. There are, ways that the COVID-19 vaccine, every time it spreads, it has the opportunity to change a little bit of its genetic code. And when that change gives it an advantage of some kind, we can see it take hold and sort of a true variant emerge that can outcompete the others. So the huge majority of the time, it doesn't make a difference. Like there's a little change in the genetic code, and it literally doesn't even change a single protein. Or if it changes one protein, it doesn't change the shape. It doesn't change anything about the virus. But when we start to see some patterns emerging of multiple cases, perhaps in an area with a similar variant, or there's some level of concern, those variants get labeled a variant of interest. And so the Lambda variant has been labeled a variant of interest because it has been outcompeting in Peru and in some other parts in South America. It clearly has some competitive advantage among others. It has been detected here in the US, including in Illinois. It has not at this point been named a variant of concern. So we go from variant of interest, where there's something a little worrisome about this. We're learning about it. It says around the world, if you're seeing this, let's make sure we're paying attention to it.
Kind of flagging it.
Kind of flagging it, exactly. And that's when they get these alpha, beta, And then a variant of concern is when there's clearly sort of a public health threat of some kind with a particular variant. It's more contagious, like alpha and like delta. It is making people sicker. It is escaping the vaccine in serious ways. It is, it's making treatments not work. There's a whole range. We've talked about this before. So at this point, it is considered a variant of interest. Could it become a variant of concern? At some point, it could. But also, it's important to note, at this point, the third level is a variant of high consequence. We've not yet had, thank goodness, a variant labeled high consequence. Probably a variant of high consequence. That would be if a variant evolves to a point where really the vaccines are not working, for example, or that it's making people so much sicker, or some major change. A variant of high consequence would have major public health implications, probably not just for unvaccinated people, but probably for vaccinated people too, potentially. So there's a lot of conversations about this. What level of concern? Where do we do this? Yeah. The WHO looks at it. The CDC looks at it. There are things that are done for the world. There are things that are done for the country. And so the Lambda variant, we are monitoring it, just like we are monitoring all of the other variants, and we are going to continue to see new variants. The main question is, does one emerge that the vaccines are not highly protective against, especially against the severe outcomes? That would be the biggest worry.
Yeah. Okay. Here's a question from Monty Capoletti from Facebook. Have gunshot murders exceeded COVID deaths in Chicago?
Thank goodness they have not. We absolutely have a major problem here, right, with gun-related violence, gun-related homicide. Sybil, as you know, the health department, as part of our Healthy Chicago 2025 plan, even before COVID, we were focused on the racial life expectancy gap in Chicago, where Black Chicagoans live almost 9 years less long than other Chicagoans. And the biggest driver of that by far is chronic disease outcomes, right. Diabetes, heart disease. And we've seen in COVID, for example, how having those higher rates of chronic disease have also, in turn led to higher rates, unfortunately, of hospitalization and death from COVID. But the number 2 cause after chronic disease is gun-related homicide, because it does impact certain communities, so much harder than others, and especially for young Black men, it is a major problem. But if we look at the numbers, and this is where I just want to, and so it's a major concern. It's certainly something the health department is working on. We've been thinking about how to use some of the things that have worked well with COVID broadly as we think about an all of government, all of city response here. Certainly there's been a lot of new investments in things like street outreach, victim services. I was actually on WBEZ last night talking a little bit about some of the vaccine prevention work and where we need to go. But if you look at the numbers, we have 800-ish in that range was about what we were seeing for gun-related homicide. and COVID has been about 5,500 deaths here in Chicago. Yeah. So both of those numbers are way higher than we want them to be. But I think it's important to, just in terms of context, those 800 approximately deaths are landing very heavily in certain neighborhoods, as opposed to being as across the city. And we've seen COVID more heavily impact certain neighborhoods, but also hit across the whole city in different ways. But yeah, that is what the numbers look like. They're both major issues, but I mean, thank goodness, right? Like we need both of these to come down.
Yeah. All right. A question from Facebook from Alex Shigart. How can we get an official proof of the vaccination accepted internationally? Like COVID vaccination passport with a QR code?
Yeah, good question. So I've been getting this question actually in my personal life a fair bit too. So the European Union, as of July 1st, put a pass in place, like a green pass, a agreement among European countries that this is the proof of vaccine that we're taking, and it is a this vaccine passport idea, so that when people are traveling, it is easy to know who has been vaccinated, because many countries have major limits and won't let people travel internationally without proof of vaccine. The U.S. does not, at this point, have a single standard for electronic proof of vaccination. And there have been conversations with the EU, I know, about this. Because it's just launched in the EU, they're sort of doing an evaluation period of it that's going from July 1st to, I think, August 14th. And the plan is sort of probably after that to do some expansion out, to other countries, link in some of this from the U.S. And there's been work here, for example, at the state of Illinois, they have been working to make it so that individuals will be able to securely sort of electronically access their own vaccine records and pull down things, like this that can feed in. And there are many apps, like Clear is probably the best known one, but others too, where you can actually, upload your vaccine card and do some of that to get it electronic. So for people who are planning to travel to Europe soon, there's a couple of things I would recommend. Number one, go look at the embassy, the U.S. embassy in the country where you're going. Like they will have information on their website that will tell you what that country is recommending, because it hasn't been universal across the board. I would definitely recommend that you bring your CDC card, like the physical card. And if it were me, I would also probably just download Clear, for example, one of those apps. They're free, they're secure, and you're able to upload your vaccine record as well as your driver's license or something, your proof of identity, so you have something electronic. And if you really want to be careful, I would probably just get a negative COVID test too and bring that, because I think depending where you're going, there's just a whole lot in flux right now with international travel. Not saying you would definitely need that, but I could certainly imagine there are going to be international places that are just like, you don't have this, especially right now while things are in flux, and you may need to otherwise pay for a COVID test, like at the airport, for example. So this is going to be an evolving space. It is extremely clear that international travel is increasingly going to be very difficult if you are not vaccinated. But even that sort of proof of vaccination, it's a bigger conversation where we want to make sure people's privacy is protected, but we also want to make sure that systems can talk to each other. So that would be my recommendation. Check with the embassy wherever you're going for the details. The airline may also have specific recommendations, but then bring your card. I would get Clear or something, just so you have something electronic, and then maybe a belt and suspenders, get a negative COVID test too.
Yeah. Not surprising, I suppose, since travel has played a big role in the spread of COVID, right?
It absolutely has, yeah. And in Europe in particular, they're just starting to relax. There have been requirements that if you traveled into these countries, you had to, pay for your own stay for 14 days in a quarantine hotel. That is still in place. Like if you want to go to Singapore, they only just recently dropped the length of that stay from 3 weeks to 2 weeks. Like many countries have been really, really careful. You look at Australia and New Zealand, they've had very little COVID, largely because they've limited a lot of international travel. So it is good that travel is coming back, but there is a lot of interest in making sure people who travel are fully vaccinated. The good news is actually that J&J 1 dose, Pfizer 2 dose, Moderna 2 dose, all of those count as fully vaccinated in all of the international settings. So that's good for people to know too.
Great. All right, we have a couple more minutes for questions, and we have quite a few about the Delta variant.
Yeah.
So, well, before I get into that one, though, there's an interesting one from Melanie Whaley from Facebook. Do breakthrough cases run the risk of infection again? Is the super antibody theory true?
Do breakthrough cases run the risk of infection again? Okay, not entirely sure about that question, but let me try to hit what I think maybe Melanie's asking. So first of all, what is a breakthrough infection? A breakthrough infection is when someone has been fully vaccinated and yet gets COVID. And it is something that we have been following closely, of course. Every time actually here in Chicago, someone is diagnosed with COVID, we behind the scenes are doing a match to say, is this new COVID case, do we have a prior record of them getting COVID? Because this reinfection, right, like that can definitely be a risk factor for a variant. We've seen, in Brazil, for example, a lot of people who had COVID in one of the earlier waves got it again with the new variant. And so we're looking back to see, did this person previously had COVID? And then secondly, we're looking to see, was this person vaccinated? And if they were they fully vaccinated? And then where we see someone who is newly diagnosed and is previously vaccinated, we're doing extra work there. We're trying to make sure we can get the sample ideally. We're seeing if we can actually do the genomic sequencing. Is this a variant? What does this look like? There's extra work in terms of contact tracing. We continue to contact trace all COVID cases. That has not gone anywhere, but that's some of what we look at. So I think if someone is diagnosed with a breakthrough case, we are certainly, because no vaccine is 100% protective. That's the other thing to,
Yes.
for people to remember. And when you're talking about an entire population, there are going to be folks. We've seen it be much less likely that they pass on COVID too. That's been the other thing. So not only is it much less likely to get hospitalized or die, thank goodness, but also it looks to be much less likely that they will pass COVID on themselves. So that's another thing that's looked reasonably reassuring, but it's not completely out of the question. And so it's about where we are diving in sort of more on that investigation. We have not seen, I don't know if she's asking if somebody has had a breakthrough once. Does that suggest they might again? If someone has had a breakthrough once, I think it's more likely that it is, as always, we've been talking a lot about this interaction between the host, us, the pathogen, the virus, and the environment. And with a breakthrough, like maybe there was something in the virus, right? You've gotten the Delta variant where there has been a little drop in vaccine protection. Maybe it is something in the host, right? Maybe there is a immune issue, you haven't responded, et cetera. It's not common, but something there. So if someone had a breakthrough, might there be, I would say probably there's a higher risk, maybe in case there was something undiagnosed or unknown in the host. But broadly speaking, we're not seeing a lot of breakthroughs, and we're especially not seeing kind of repeat infections.
Double breakthroughs.
No. And we are learning a lot about, there's a lot of work that goes into investigating really everything we can know about cases, not just here, everywhere around breakthrough, because it's one of our signals for, are there potential changes or concerns in how we need to treat this.
And have you heard of this super antibody notion?
Yeah, so this is probably the Delta plus thing. Again, there are different, there's sort of the Delta, and then there was another kind of even further variant that emerged from India. If it doesn't get named as a whole separate sort of variant of concern, I don't think of it particularly differently, right? Where we're sort of doing that tracking and following it. I mean, when we get the list of sort of all the variants we're seeing, even here in Chicago, it's a very, very long list. And so, yeah, you can see, Delta, you can see Delta Plus, you can see Lambda, you can see Alpha, you can see, and the thing we're interested in is, are we seeing a different distribution of that than what we are seeing across the region? So, or across the country. So, for example, a month or two ago, we were paying a lot of attention to what at that point was called P1, the variant that originally came from Brazil that is now, I believe, Gamma. It got renamed. That one we actually had a lot of here in Illinois and even in Chicago. Like we had the most in Illinois across the whole country at one point. We were having conversations with CDC, but we didn't see that turn into a major surge in hospitalizations or deaths. We also, I think partly because we have more of that one, may be why our Delta is a little bit lower. So that was one we were paying extra attention to. And if we were to see any of our variants be here way out of proportion from what you would expect, that would also lead to additional investigation. So it's not so much how many, like the exact number doesn't matter. It's more like in comparison to how many have been tested, are there unusual patterns? And we haven't really seen that.
Okay. So much we could get into with those variant questions.
Yes.
Let's close with this question from Kim McDonald from Facebook. I registered for someone to come to the house to give my kids the vaccine.
Okay.
Who comes to the home? I've heard two different things.
All right, so it depends a little bit on when this happens, and et cetera. So in the initial phases of this program, it was actually the Chicago Fire Department that was doing a lot of this. This was EMS providers, and many of them throughout this time have actually been willing to, we've been able to pay sort of on times when they're not doing their shifts, and then where there's been some capacity, they've been really important in terms of supporting. At this point, it's not Chicago Fire Department. It is with various vaccine providers, and so we have a number. We did a competitive process, and there are clinical providers. So these are obviously licensed clinicians, and they could be coming from a hospital. They could be coming from a clinic. They could be coming from one of the groups that is doing a lot of our mobile vaccination, but they are all coordinated through the health department. And so we are setting up, in this region on this day, here is the batch that are going to be done. And where you're working to contact people, et cetera, it's all done through CDPH, so we can kind of keep an eye on what's happening and follow that up. So I can't, not knowing exactly where you live or which day, I can't give you the exact answer, but I can tell you it is absolutely a licensed medical professional who has the appropriate license and the appropriate training to do vaccine. They're coming with the vaccine in the special cool boxes that the health department has that are monitored very carefully to make sure the temperatures and location and everything is done. And all of the appropriate protocols are followed in terms of monitoring and registering and all the rest of that. So there's a lot of quality control there. And you'll get somebody who at some level has volunteered to do this, right? Has sort of said, I want this. And we've had actually volunteers be part of this too, especially earlier on. People who feel really strongly about vaccinating, and all they do all day, every day is go and bring it to homes and have conversations with folks and have little vaccine parties.
Yeah. And they're all official and identifiable.
Yes, that's right. They have identification. Like all of these things are absolutely in place. And if you have a question, with more detail about that, you can call the same number you called, 312-746-4835, or chicago.gov/@home. There's more information about that.
All right. Well, hey. We're out of time.
We're out of time.
Did
Good.
you have any good news nuggets
the only thing I wanted to just note was that we have been getting, which I appreciate, and maybe we'll have some more conversation about. People have been really interested in, COVID's impact on some of the mental health and substance use, violence prevention, and it's certainly something we have been doing a lot in and continue to do a lot in. This afternoon at 3:30, I am actually standing up with the superintendent of Chicago Police Department, Superintendent Brown, and we're doing a press conference and conversation about an expansion of this narcotics arrest diversion program. And so it's something that we're excited about. It's sort of taking a public health approach to another thing that is a big problem, opioid overdoses in Chicago. I mean, there were more fatal opioid overdoses in Chicago than there were gun homicides last year too.
Yes.
Although nowhere near as many as COVID, but another really big problem in Chicago, and we're working together to take some sort of public health approaches to make sure people can get the access to treatment,
help that they need.
Exactly. So if you're interested, we're doing that at 3:30, the narcotics arrest diversion program, and certainly if this is an interest, we'll be probably bringing on some folks to talk more in detail about these indirect effects of COVID and some of what we're trying to do.
Yep. All right. This was a full session.
It was.
Ask Dr. Arwady.
It was. Thank you for being here. Thank you for tuning in. And I loved, just to bring it back to Scott there, who is like doing his own research and writing in about his friends. Please keep doing that. Getting your friends and family vaccinated, being respectful about their questions, and getting them really vetted information from good sources is something we all can do to make sure people have the good information and get protected so that we can stop talking about the variant of the week, the month, the year.
Yeah. And we're in a good place, but there's a lot more work to do in terms of getting more people vaccinated.
That's right.
So really appreciate all the ambassadors out there.
Yes, very much so. Thanks. We will be back next week. Have a good weekend.